Do you feel like people ever treat you differently or like a baby because you have a disability?
Yes.
Yes, this is her. Her right hand is yes and her left hand is no. So I would agree. Again, it comes back to the way we're perceived in public and the way she is perceived is that she's just so much less capable than she is. And it's a hard thing for her to talk about. She doesn't like this topic of conversation, so I'm sorry. We'll get through it, but this is...
And she doesn't like it because she is very smart and she does think about this stuff, and it bothers her. So we both work and both have jobs that require us to be in office a fair amount, and so finding qualified and willing and available care, especially during the summer months, can be really difficult for us.
We have the TA waiver here in Kansas, the technology assisted waiver that she's qualified for since she was 3, I think. And that's been a tremendous help. Finding people to fill those hours is tremendously difficult. So it's been a game changer for our family. And I don't think people understand how much goes into it, that caregiving is a job, I have a full-time job, and that finding other people to provide any care for her, managing everything about her life because of her level of complexity is a lot of work. It's really taxing, and I think that a lot of existing respite resources are devoted. I just want to be clear that when I say respite, I mean broadly, but I also specifically mean for kids with more medical complexity and more physical involvement that might need a higher level of support and more qualified staff available to provide that. So I started a nonprofit this year. It's called Rest KC, and it's inspired by this kiddo, and our primary audience are families like our own, so children with medical complexity and developmental disability. The long-term vision with Rest KC is the development of a respite house in this metro that would be medically equipped for families affected by disability, where it's a destination, a wonderful destination for the children, and also a really safe place that parents can feel really good about leaving their kids if they have to.
Mm-hmm. We have been really grateful and fortunate to have our Medicaid through Kansas that we have. It's been life-changing. It has enabled us to maintain our careers and to have a positive family experience, and I don't know where we would be without it.
I always say the TA waiver, or the technology assisted waiver that Myra has been on for several years now, was the most positive thing to ever happen to us, and we honestly have absolutely no idea where we would be without it. If we didn't have this waiver, I would not be contributing to the Kansas economy in the way that I am. I would probably be racking up a lot higher health bills for myself if I didn't have the supports that I do through the waiver. Mm-hmm. And I think about the over 5,000 families that are on a wait list for the IDD waiver who have a 10-year wait to have access to that waiver. And again, how strange it is to be in a position where you're grateful for the complexity of your child because they could immediately access services that thousands of other Kansans cannot. So I would tell legislators to think of all Kansans. I think it's almost easier sometimes to see a child like Myra and it immediately clicks for you that they need supports and services, and that families like ours need supports and services, and we do, and I don't ever want those taken away.
I think Kansas for us has done a great job of helping to maybe eliminate some of those complexities or make them less complex, and it's done a lot to enable us to live the great life that we live. I would love to see that extended to more people.
Do you want to live at home with us forever or move out and be independent? And let's say your right hand is at home with us forever, and your left hand is, I want to move out and be an independent woman. Lefty?
There's a left up.
Are you moving out?
Tomorrow.
Are you moving out?
Myra, do you remember